All right, we're picking up in blood after the white blood cells at what are platelets and what is their function. So platelets are pieces of cells. They are one of our formed elements, but remember they are not whole cells. They are literally just pieces of cells. This is one of my favorite words. I don't know why it is one of my favorite words. I think it's because it sounds so nonsensical. But blebbing is when cells like shed off little pieces of themselves. Here you have a megakaryocyte that is it's blowing up, and when it blows up into all these little fragments. So you can kind of think of platelets like it's shrapnel that's going to help you stop bleeding. That's what they are. What's their function? Help you stop bleeding. The name for help you stop bleeding is hemostasis. Hemostasis, if you break it down, hemo means blood, stasis means like staying still, stopping, so this is stopping you from bleeding. It does sound a lot like homeostasis. Hemostasis is a type of homeostasis that works through positive feedback, at least portions of it do. But make sure you're not confusing the two. So hemostasis is you not bleeding anymore. The 3 steps to hemostasis. Did I have it on the last slide? Yeah, I did. Okay, sorry. These are the 3 steps that you need to know. People tend to think of hemostasis like it's clotting. Clotting is just one part of hemostasis. There's other parts too. The part that involves platelets is called platelet plug formation. This is where the platelets get activated, they get sticky, they start to stick to each other and to anything around them. When they do that, they sort of plug the hole so that blood stops flowing past that hole. Vascular spasm is what I like to call kink the hose, because if you kink a garden hose, you know water starts either flowing more slowly through it, or it stops flowing through it. Same thing works here. If you kink a blood vessel, blood's going to flow more slowly through it so that you won't lose as much blood, or hopefully you'll stop losing blood altogether. Coagulation's about the plasma, and we'll come back to that in a minute. Okay. Then you've got, let's see, define coagulation and explain how clotting factors relate to that. So, coagulation, I mentioned a second ago, it's a plasma thing. I'm actually going to, well, I think I got to turn my pointer back into a pointer. Where are you at, pointer thingy? Here you are. I'm so sad. That's not really what I want either. I want arrow options. Here we go. All right. So I want you to watch what happens here. They take some blood and they put 1 drop of rattlesnake venom in there. And then you can see that blood is now a clump. That is coagulation. What's happened is what was liquid plasma is now a semi-solid. It's like a gel at that point. So that video does more for explaining what coagulation is than anything else that I could tell you. This is how rattlesnake venom kills, incidentally, which is another reason why I just adore this video. But that is clearly not going to be flowing through your blood vessels anymore once that happens. And so there you go. There's my gross video for the day. Okay. Second half of that question is explain how clotting factors relate to this process. So coagulation is something that you don't want to do it unless you absolutely need to do it. You don't want to do it to all of your blood at once because, again, this would be very bad if all of your blood did that at once. So you want to do it in a localized place for a specific reason. So, because we need to very finely control when and where this happens, there is a whole chemical cascade that has to happen to make this process occur. Clotting factors are the chemical steps that have to be present in order for coagulation to occur. If every single one of these things is not present, your blood will not coagulate, which means you will not be able to clot your blood and you will have a bleeding disorder. Now, I'm not going to make you learn all 13 of these, but there are 2 in particular that we're going to spend some time talking about, fibrinogen and prothrombin. I want you to notice that calcium ions are here. Remember I told you last semester, calcium ions is for way more than just strong bones. You need it for your blood to clot as well. Factor 8 is important because if you've ever heard of hemophilia, This is one of the most common factors that is missing in people with hemophilia. But there's other things in here too. This is another one for another genetic condition. There's others in there as well. But again, if you want your blood to coagulate, you got to have all 13 of those. They've got to be present. They've got to be active. Then your blood will coagulate. Let's see. This is just, I love this picture. It shows you what's known as a fibrinet. So ordinarily, you have this protein that is dissolved in your plasma. It's called fibrinogen. It's just floating around as a solute, dissolved happily, and your blood's just flowing and again, happy. Whenever you get a wound, the calcium release starts this cascade reaction that involves all those clotting factors that you saw from just a second ago. And one of the end results is going to be the fibrinogen turns into a fibrin net. This brown goo that you see through here, that's the fibrin net. And it's called a net for a reason. Imagine that you throw a net over the wound. That net is going to catch the blood cells so that now your blood cells aren't leaking out of you. This is essentially an electron micrograph of the clotting process. And it shows you how your plasma has solidified. And fibrin is a big, huge part of that overall process. Okay, so getting that sort of in the notes. Fibrinogen, normally floating around in your plasma in an inactive state. So this is just plasma. Again, you know you can donate, aka sell your plasma. It's in here, it's dissolved, it's not in that mesh form just yet. Here's where we got to back up though, because there is also another thing floating around in this plasma in an inactive state that's called prothrombin. So there's two clotting factors just floating around, not doing anything, waiting to be told that it's time for them to do something. When you get a wound, the tissue cells in that area, the damage causes them to release calcium ions. That calcium ion release converts prothrombin into thrombin. So we convert one of those inactive things into an active thing. This is our first chemical cascade reaction. Once thrombin is activated, thrombin is what helps convert fibrinogen into fibrin. So again, second step in our cascade reaction. So calcium converts prothrombin to thrombin. Thrombin converts fibrinogen to fibrin. Fibrin's the net that catches the cells to make everything stop. There's a bunch of other steps in this process that we're not going to go over. These are the ones that I want you to get. End result here, though, is the blood is going to keep mushing up or pressing up against this net, and eventually you end up with this fibrin that's been catching these cells and cells that have been smushed into the net. And so you've got this big, huge quilt of fibrin and blood cells that is covering the wound. Originally, you had a platelet plug. That was a temporary seal. It helped you at first. This is a more permanent thing that you guys would call a scab. A scab is the fibrin net with blood cells quilted into it to seal the wound while you more permanently make scar tissue to permanently fix the wound. So the blood clot is an intermediate step between the platelet plug and the scar tissue that's going to be the permanent fix there. Okay. What happens if a person's missing a clotting factor? They don't coagulate. You don't coagulate. If you get even the tiniest wound, it is going to not stop bleeding. That is called hemophilia, aka a bleeding disorder. Anticoagulants will make it seem like a person has a bleeding disorder. We call anticoagulants blood thinners because it makes you less likely to form a platelet plug or a fibrinet. So it makes hemostasis less likely to happen. There are lots of reasons why we want to do this. Hopefully you have picked up on the fact that strokes, heart attacks, pulmonary embolisms, and other clotting disorders, they happen because a clot has formed. If you're forming clots that are problematic, we would like to stop that process from happening, so we would put you on anticoagulants to stop that process from happening. So we've got like over-the-counter anticoagulants, that's baby aspirin. We've got injections that we can give you or put them in an IV, that would be like heparin. Also, your liver naturally makes heparin. once you get it going, that is. We also have prescription anticoagulants like warfarin, and then there's newer ones that are out there too. Warfarin's old school. Let's talk warfarin for just a second. Warfarin is rat poison, so that's why I have that up there as a picture. But warfarin is also a prescription blood thinner or anticoagulant. I had a guy on my Meals on Wheels route who was convinced his doctor was trying to kill them because he used warfarin out in his barn to try to kill the rats. And then he found that his doctor put him on warfarin, so clearly his doctor was trying to kill him. So the way warfarin kills rats is because it's a blood thinner. Well, rats are getting injured all day, every day. They get into fights with each other. They get into fights with predators that are trying to harm them, cats, dogs, hawks, whatever. And so I don't know if you've ever seen a wild rat. Like, they're always missing chunks of tail, missing a toe, missing pieces of their ear. They've always got parts missing because of the fights that they're in. If your blood cannot clot, those little injuries will kill you pretty fast because you cannot stop yourself from bleeding. That's how warfarin works as a rat poison. It prevents them from clotting their blood, so those little injuries will make them bleed to death. Now, why was my Meals on Wheels person on it? He had had multiple strokes. The doctor did not want him to have more strokes, so they put him on warfarin to prevent the clots from forming so that he wouldn't have more strokes. He was supposed to go in for routine appointments to make sure that he was being given just the right dose of warfarin, not so much that he couldn't stop himself from bleeding, but not so little that he would form more clots and have strokes. That's how warfarin works for us. It does require routine blood work to make sure everything is working like it's supposed to, because you're not maintaining your own homeostasis, essentially. Okay, once your clot has done its job and we now have our scar tissue in place, we need to get rid of the clot. We don't want it to be there. We don't want it to dislodge and start floating around. Again, that's how strokes and heart attacks happen. So we need to break the clot down. That process is called fibrinolysis. Tissue plasminogen activator is a chemical that gets released once the scar tissue has developed. You normally have plasminogen floating around. Tissue plasminogen activator converts plasminogen to plasmin. Plasmin breaks down the clot for you. TPA is also something that we use for people who are currently having a stroke or heart attack that is the result of a clot, to dissolve the clot so that we can save any tissue that has not already died. Okay. Anticoagulants, fibrinolysis, okay, heparin. Heparin is, again, a naturally produced anticoagulant. It's produced in the liver. The other side note that I'm giving you up there is newborns, their livers aren't quite, I like to say they're not turned on yet. Like, it has to take them a little bit for their liver to get kicked on. That's one reason why babies will often have jaundice. It's because their livers just aren't working just yet. So we will very often give babies injections of heparin so that their blood doesn't clot unnecessarily. The reason I'm showing you this picture, this is Dennis Quaid. He's a celebrity, been in lots of movies and whatnot. He had these twins relatively late in life. His twins, the nurse actually gave them, I think it was like 100 times the dose of heparin that they were supposed to have. She didn't check the label, and she overdosed the kids on heparin, and so they could not clot their blood like they were supposed to. So we give them just enough heparin to make sure their blood doesn't clot unnecessarily. She gave them so much heparin that their blood couldn't clot at all, and that's not okay either. And so they had some problems after birth as a result of that oversight. I'll call it an oversight. All right, disseminated intravascular coagulation. So disseminated means body-wide. Intravascular means inside the blood vessels, and now you guys know what coagulation means. So this basically means all your blood has decided to clot all at once. This is clearly not good. It is a failure of your entire clotting system all at the same time. It is very often a secondary result to something like sepsis, where you have an infection and your body's just like, well, screw it. We were already going to die. We might as well just take her out faster. People with DIC very often die as a result of DIC. It's very hard to fix this problem because blood pressure is going to plummet when your blood clots all at once, and your kidneys are more than likely going to fail. You're, again, going to have lots of heart and brain and liver problems as well. It's possible for us to save you. It is very difficult for us to save you, essentially. When the blood clots like this, it tends to tear open the blood vessels, so any remaining blood that hadn't clotted yet leaks out, which is why the bruising that you're seeing here is relatively characteristic of a person with DIC. If you ever see this, that person needs medical treatment in the ICU immediately, and even then, again, chances are pretty good they're not going to make it. Thromboembolic disorders. Okay, so in order to break this down, you got to understand some terms. So a thrombus is a clot. An embolus can mean different things at different times, depending on what you're talking about. Here in the world that we are in now, it basically means a traveling clot. So this means that you're clotting when you should not be clotting. This is when we would be putting people on those blood thinners from earlier, the aspirin, the warfarin, the heparin, whatever. Okay, so if a person develops a thrombus, like one of the things they warn you about, especially as you get older, is if you travel on an airplane, please get up and walk around every now and then, because just the act of sitting down and bending your knees makes it more likely that a clot's going to develop in the veins in your legs. And if that happens, that's called a thrombus. When you get up and start moving around to disboard the plane, once that clot dislodges and it starts traveling in the bloodstream, then it's called an embolus. And here's the thing, if it formed in a vein, the veins get bigger and bigger as we get closer to the heart. So things are okay at first. Eventually we'll make it into the vena cava and then get into the right side of the heart. But then the right side of the heart is going to pump the blood to the lungs. And once we get to the lungs, the blood vessels are going to get really small again. So that clot that had been traveling around, it is now going to get stuck in these small vessels that are in the lungs very often. When the clot gets stuck again, that's called an embolism, and now we have a medical emergency. If you get a pulmonary embolism, that causes fluid buildup in the lungs. It's going to make you drown in your own fluids and die pretty quickly. If the clot gets stuck in the heart, you're going to have a heart attack. That can kill you pretty quickly. If the clot gets stuck up in the brain, now you got a stroke. That can kill you pretty quickly. Point of the story is, you don't want an embolism. Embolisms kill you because tissue starts to die. Now, since this was a clot problem, again, remember, we do have meds that will dissolve clots. So as long as we can get that med into your system fast enough that we can still save tissue, we can save your life and even save most of your quality of life, but you have to get treatment quickly. Because again, pulmonary embolisms will kill you pretty darn fast. You don't have a lot of time to go get your medical treatment there. Okay. Warfarin I already talked about. I already mentioned the constant lab work and whatever. If you don't know, RX means prescription. You should know that. Now you do. Thrombocytopenia. So remember, thrombocyte, that's another name for a platelet. Penia means deficient in, so that would mean you don't have enough platelets. If you don't have enough platelets, you can't do a platelet plug, which means you can't do hemostasis very well. Thrombocytopenia is one of our kinds of hemophilia, but hemophilia is usually sort of saved as a diagnosis for people who are missing a clotting factor. Hemophilia is a genetic condition where a person can't make a specific clotting factor, and it's usually treated with transfusions, although we're getting really close to being able to fix that with CRISPR-Cas and gene therapy, so hopefully in our lifetimes we will fix that. Treatments for transfusions or other things that we're going to be talking about soon, but hemophilia is we can give them blood transfusions. Sickle cell anemia that we talked about earlier, treatment for that is blood transfusions. If a person has lost a lot of blood, treatment for that is a blood transfusion. Sometimes, like in hemophilia specifically, we can also just transfer plasma and do a plasma transfusion, and that can solve the problem. We can do packed red blood cells for anemia. We can give you different things, but if a person needs everything, then we will do a whole blood transfusion. That's where I'm going to stop this video because I want blood typing to essentially be its own video, so that'll be in the next one.